morning, this is All India Radio Kohima. I am Nabin Pradhan with the morning news. The total COVID-19 cases in the country has gone up to 13,835 with active cases standing at 11,616 till late last night. The total includes 1,767 persons discharged from hospitals after recovery. The death toll has reached 452. Meanwhile, the Union Health Ministry has said that India has been doing better than many countries on the outcome ratio, that is, the ratio of number of COVID-19 recoveries against the number of deaths. It said the government is taking efforts to further improve this ratio. Nagaland Principal Secretary Home Abhijit Sinha said that as on 6 p.m. yesterday, 48 suspected COVID-19 samples were sent for testing from the state, taking the virus tests total to 274. He said that the results of 222 samples have been negative, while 4 samples have been sent for retest, while the results of 48 samples are awaited. In relation to the positive patient from Dimapur detected in Guwahati, he said a total of 141 samples of the persons, which includes co-passengers, healthcare workers and family members connected with him, have been collected till now and sent for testing. Out of this, results of 138 samples have been received and all are negative, while 3 results are awaited. Sinha further appealed for continued adherence to the lockdown measures and requested everyone to stay home and come out only if it is unavoidable for buying food items and other essential commodities. Nagaland Chief Minister Niphyu yesterday held a meeting through video conferencing with the Deputy Commissioners, Superintendents of Police and the Chief Medical Officers of all the districts to review the implementation of the lockdown measures and preparedness for combating COVID-19. During the meeting, the districts gave a detailed briefing of their preparedness and also mentioned about the various issues pertaining to their districts. The Chief Minister complimented everyone for the efforts made till now and advised for continued vigil on the situation and more interventions by the officers for further enhancing the level of preparation. Nagaland Minister for PHED Jacob Jimomi chaired a review meeting on the preparedness of Dimapur district to contain the spread of COVID-19 in the district. The meeting held yesterday was attended by Advisor for Power Tovihoto IME, Advisor for Excise, Sericulture and Minority Affairs Jalio Rio, MLA Ajeto Jimomi and officials from District Administration, Police, Medical Department and Food and Civil Supplies. The meeting decided that the District Administration will deploy administrative officers for streamlining of distribution of essential commodities and issue directives to the village council chairman and GBs to ensure that it reaches the needy persons, particularly daily wage earners, stranded laborers and migrants. The village council chairman and GBs have been directed not to obstruct movement of administration, medical, police, press and people rendering essential services under any circumstances. Arrangements have been made for home delivery of sanitized LPG cylinders, medicine and accessibility of fresh food in the quarantined areas. A helpline number 9609618473, I repeat 9609618473 has been provided for the quarantined areas of Marwari Patti, Murgi Patti and GS Road. The Chief Medical Office has been asked to prepare the menu to be served in the quarantine centers to ensure balanced diet, while Western Sumi Hoho, Naga Council Dimapur and Food and Civil Supplies Department would work in coordination with the Dimapur District Task Force. Deputy Commissioner Dimapur Anup Khinchi has informed all concerned that in view of the sealing of Marwari Patti, Murgi Patti and GS Road as a containment measure to prevent the spread of COVID-19, the existing vegetables and fruit wholesale market of Murgi Patti will be shifted to Naga Shopping Arcade Supermarket for its operation from today. The timing is 6 a.m. to 12 noon, while all transactions have to be done mandatorily keeping social distance as per norms of COVID-19. Kipire District Hospital, which has been converted into COVID-19 hospital for the district, is being equipped with facilities for positive patients. During a meeting of the Kipire District Task Force for COVID-19 held on Thursday, Chief Medical Officer Dr. E. Motsuthang Patton informed that one portable ventilator has been installed at the COVID hospital with 38-bed facility and can be accommodated up to 50 beds. He said 1,750 FFP1 masks, including other essential equipments, have been received so far. He also said that 4 quarantine wards have been prepared with 31 beds. Nagaland Minister for Planning and Coordination, Land Revenue and Parliamentary Affairs Niba Krono along with colleague MLAs Kujolujo Nieno and Kejini Khalo yesterday visited Phek District Headquarters and interacted with the officials of District Administration, Security Forces and Food and Civil Supplies in the office chamber of Deputy Commissioner Phek. Krono urged the officers to jointly venture out in fighting against the deadly disease and strictly adhere to lockdown measures as it is the only way to stay safe from the pandemic. He further requested the officials present to closely monitor the judicious distribution of essential commodities by coordinating with the local leaders. MLA Kujolujo Nieno shared on the importance, equality and transparency in the distribution of essential commodities. MLA Khalo expressed his concern over the availability and utilization of medical facilities, including PPE and other protective gears, so as to maintain safety measures. The team also inspected the district hospital. With that, we end the morning news. Have a nice day.